Dr. Ruan, Dr. Abeykoon, Mr. Stewart, and Mr. Heren. It's wonderful to have everyone here today. We are here to talk more about the histiocytosis trial and provide some of the patient experience and in participating in this trial as well. As I understand, this is a relatively new trial that Dr. Ruan and Dr. Abeykoon, you are leading, and shows some really promising opportunities for people that are navigating a histiocytosis diagnosis, and really eager to learn more about it and share this with the histiocytosis community. So first, love to get started with some introductions. So Dr. Abeykoon, Dr. Ruan, would you mind introducing yourselves and giving us a little more of an understanding of what got you interested in researching and working with people impacted by histiocytic disorders?
Yeah, Deanna, I will go first. Thank you very much for this opportunity. And Heren and Jim, thank you so much for coming and sharing your experience here. Dr. Ruan and myself are involved in histiocytosis because first and foremost, it's a non-curable, a rare disease that a lot of people are affected, but not much research has been done. So because of that, we all know that this is a non-curable disease, and we are from the Mayo Clinic, and we have a lot of patients that we see in day-to-day practice, and we have a big team which we call the Histiocytic Working Group, where Dr. Rongo, myself, Dr. Ruan, and other physicians in multidisciplinary teams lead that team and that working group, and we share patient stories and discuss the patient stories and see what is the best approach for treatment for our patients. Diana, you asked a good question, why we get into the research area. Because there is a lot of unknown things to find. Number one is that this is a rare disease and incurable disease, and most patients suffer from the morbidity and the morbidity mainly associated with the disease. The side effects, their quality of life has decreased, and we know that although there are FDA approved medications such as vemurafenib for Erdheim-Chester disease and cobimetinib for histiocytic malignancies throughout, that means LCH, Langerhans-Selleroy-Dorfman, or Erdheim-Chester disease. These treatments are first they are chronic treatments. That means the patient should be there for a long time, and if you discontinue such treatment, the disease relapse back in majority of patients within 6 months, a short time period, and the patient always needs the next line of therapy. And the research that not much research has been done, what is the best other treatments rather than these targeted agents. So that is why we focused on in a different angle, not studying the MAP kinase pathway or the other pathways that other people have studied, but a different angle to utilize the pathobiology of histiocytic cancers and repurpose or discover new treatment strategies for patients with histiocytic cancers.
Great. Thanks, Dr. Abeykoon, for sharing your perspective there. So for myself, my name is Gordon Ron. I'm one of the senior fellows here at Mayo Clinic in Rochester. Have worked very closely with Dr. Abeykoon throughout my career here at Mayo, and have really benefited from his outstanding mentorship. And for me, one of the reasons where I got very interested in histiocytic disorders is, similar to Dr. Abeykoon mentioned, it's a very rare cancer and condition, and unfortunately, there's not that many treatment options available. Thankfully, we've come a long way with, Erdheim-Chester disease in terms of, establishing the targeted therapies. But, for these much more rare subtypes that we'll, kind of talk more later, in regards to histiocytic sarcoma, indeterminate dendritic cell tumor, there's really no established standard of care. And, I think one of the most challenging and most emotionally difficult situations for patients is when they're diagnosed with these rare conditions and no one knows what to do, right? Even though it's very rare, but if you're the patient that has it, it's not rare to you. And I think it's really important that we take that responsibility to be able to provide better care to patients with these rare conditions, and be able to provide hope, and also be able to allow them to, live as best a quality of life and longevity of life as possible. And I think it's really incumbent on us as doctors to, again, help these patients with these rare conditions, and not to just kind of put it to the side because of how rare it is. So I think that's one of the things that really got me excited and interested. Um, I'll let Dr. Abeykoon kind of talk a little bit more too about some of his one of the trial related experiences that he's been able to lead forward, and then we'll introduce Hank and Jim shortly here.
Thank you, Gordon. So always I envision that I need to do something different than the rest of the world. So that is what I think, because I don't. So that is why I wanted to study a different pathway, different biology than the most known pathophysiology or pathobiology of histiocytic cancers, such as, I didn't study the MAP kinase pathway or the associated proteins, but I wanted to see what other proteins are there overexpressed in these cancers. So in that study, I started this bench work in around 2016, and from 2016 to 2020, we studied this at the bench, and we studied a protein called CRM1, chromosome regional maintenance protein 1. So that is a protein that transfer molecules from the nucleus to the cytoplasm in all our cells. Every cell needs this highway that transfer proteins from nucleus to the cytoplasm, and that is important for the survival of a normal cell. However, we identified that in histiocytic cancers, the Erdheim-Chester, Langerhans cell, the Rosai-Dorfman, and histiocytic sarcoma or malignant histiocytosis, and other histiocytosis, these cells overexpress that CRM1 protein, overexpress it. So suggesting that they rely on a heavy traffic from the nucleus to the cytoplasm to sustain their survival. After understanding that, we came up with a drug combination which inhibits the CRM1 protein, and also it has another pathway that impairs the DNA damage repair of a cancer cell. So when cancer cells proliferate very rapidly, there is an inherent DNA gets damaged because of the replication stress. The more it replicates, the more wear and tear. The cells depending on specific DNA damage repair mechanisms to repair this broken DNA. One repair mechanism is called homologous recombination repair, HRR. And we identified that by combining a CRM1 inhibitor with salicylate, we can effectively inhibit this homologous recombination repair by downregulating a protein called RAD51, so that these cells are impaired of the rapidly proliferating cells like cancer cells are impaired of repairing the inherent DNA damage that caused by their rapid proliferation. And that remaining DNA damage will lead the cells to signal death, because cells cannot survive with damaged DNA, so the cells die. So those are the two different mechanisms that we put forward as a mechanism of action of this drug. So one is to block the highway that communicates from the nucleus to the cytoplasm of a cell. Second is by decreasing the DNA damage repair mechanism of a cancer cell. Combination of these two deemed very effective in treating cancer. So we identified that. We published our paper in 2021 in Blood, and then we brought this discovery from bench to bedside through an investigator-initiated clinical trial. The principal investigator at Mayo Clinic is Dr. Jonas Paludo. He is the overall principal investigator, and this is a drug which is Selinexor, which is a CRM1 inhibitor combined with a salicylate called choline salicylate, and that is all oral medication, and that is how this surfaced to the clinic. And it is a basket trial where we include patients with all histiocytic cancers, so histiocytosis and lymphoma. we will be able to treat all these patients, Hodgkin and non-Hodgkin lymphoma. It's an early phase clinical trial. We have seen very intriguing results both in patients with lymphoma and histiocytic malignancies. And what is intriguing is that it is investigator initiated. That means we discovered it, we brought it from bench to bedside at the Mayo Clinic, and Dr. Ruan and myself, Dr. Go, Thomas Witzig, all are involved in one team to take care of these patients.
Great, thank you, Dr. Abeykoon. So I think we've talked a lot. Let's hear from, Hank and Jim. So maybe Hank, I'll have you go ahead, introduce yourself first, and then we can have Jim introduce himself, and then we can go from there. So if you wanted to give just sort of a brief overview of kind of your background and journey, and then we'll go to Jim afterwards.
Okay, well, good morning, everyone. My name is, actually, my birth name was Henry, but I go by Hank. I live in just outside Peoria, Illinois, and my journey started in late 2018. I started getting some extreme abdominal pain. I went to my local doctor. He took an immediate interest in what was going on. And of course, I went to the local, he referred me to the local hospital here, and they took several biopsies, and then they sent him out. So my initial diagnosis, which was incorrect, was stage 4 colon cancer. But the doctor that told me what I had also indicated that they sent the biopsy out to another lab, an independent lab, to get further confirmation. But then I came in on Monday, and when I got there on Monday, he indicated, well, the good news and bad news. And the good news was I didn't have stage 4 colon cancer. The bad news is they didn't have a clue what I had. He made the determination they're going to refer me to the Illinois Cancer Clinic. Fortunately, I'm still very close to my doctor, my family doctor, because he wanted to know what they were telling me, and he indicated if I didn't get a satisfactory answer, he was going to give me a referral to Mayo Clinic. But fortunately, the doctor at the Illinois Cancer Clinic, she did give me a referral. But even from the initial diagnosis, I think the critical piece for me was acceptance plays such a huge role wherever you are. Fortunately, I was able to draw on my faith that I'm the type of person being brought up as a baby boomer. I had to give some time for reflection, figure out where this was, even with the initial diagnosis of colon cancer. And I made the determination that I was going to do whatever I could to fight this battle, because I knew I had a good support system around me. So acceptance came right through for me. So when I got the referral to the Mayo Clinic, obviously I still kept up in my faith. And then I get a phone call from the doctor at the Mayo Clinic, Dr. Keith Bible, Bible. I knew I was going to the right location. And it's been an incredible journey after that. I went through an extensive round of testing for about a week. And then even when he told me what I had, the rarity of it, I had already accepted where I was. So much compassion and understanding. I know Dr. Ruan was talking about hope. I immediately put my hope in not only Dr. Bible, but the Mayo Clinic in general. I felt I was in the right place. And I'm not trying to be noble or a martyr or anything or become a saint, but I said, you may not be able to save me, but you do whatever you need to do. I'm willing to take anything that's out there to hopefully can provide a cure or end up finding a cure for this cancer, because I knew it was going to be difficult and challenging, but there wasn't too many medical facilities willing to take on this challenge. So obviously I knew not only I was in the right place, plus the fact that I knew that I wanted to be someone that can kind of send that message forward. So since that point, I've created awareness. I reach out to several hundred people every day, cancer patients, not just rare cancers, because there's only a few of us, but even with people with other types of cancers, as I met them along this 5-year journey. Some people might say there wasn't a lot of hope, but I put my hope in the medical facility there at Mayo. Even though Dr. Bible retired, up comes Dr. Abeykoon, and he's been like one of my best friends. I've established whatever he wants to do to me, it's okay. I look at it as an opportunity to help others. You know, I mean, I've had the opportunity to talk to a lot of people that have, with younger people, as young as 16 years old, that have passed with some type of histiocytic disorder. And I said, I want to do more. I want to continue outreaching to reach out to more people to let them know we can be the hope for the medical community. They need people to step up, to be to put their lives in these doctors' hands. I have complete trust in the Mayo Clinic, and I'm looking forward to see where this trial goes. And I want to continue sending that message forward to be there as a support system for other people because I'm truly blessed in this experience. And I wouldn't change a thing in my journey. Uh, it has made me look at life a lot differently, a lot more appreciative, a lot more thankful, and especially with an opportunity to reach out to other people. It's been just an incredible blessing, and I'm thankful just to be a part of this upcoming trial. Thank you.
Thank you, Hank, for sharing your story. Really encouraging and certainly great to have you be such a strong patient advocate for others and to be able to, have others kind of see you as you walking through your journey and have hope as well. Jim, let's have you go next and we'll go from there.
Hey, I'm Jim Stewart. Good morning to everybody. My journey kind of started right when I was getting ready to retire. I'd worked 50 years, and so my wife and I both retired about the same time. I had a few problems, and again, the name of the cancer, and which it attacked my skin. So I went to dermatologists around here, and several of them, and several biopsies, and they everything would come back non-conclusive. So they, I even had one tell me that I didn't have. It wasn't cancer, but they weren't sure. The journey continued. This was in 2019, and the journey continued with several doctors. I was put on some steroids and some other medication here that helped a little bit, and they thought they had it, maybe found out what it was, but it came back and it came back. And Siteman Center in St. Louis, they did a lot for me. They were almost sure it was leukemia, and they had performed several bone marrow biopsies and stuff like that, which all kept coming back okay, no problem. After about 2 years of this or so, my daughter and my dermatologist here in Carbondale basically wanted me to go to Mayo Clinic, and my doctors in St. Louis were more than glad to refer me there. And so my journey started to Mayo Clinic. We were up there in 2022. In February, the whole family went. We met with Dr. Ruan, Dr. Polito, Dr. Gold. So basically, I had to do a bunch of tests, and it wasn't no time till they'd found out the cancer that I had, or that it was cancer. And by this time, I had broken out on my back, my hips, my face, my chest, and back and legs, and I don't know how many tubes of cream and how many tubs of cream, and it was just a constant battle to keep the itching down. At this time, when we got diagnosed, there basically wasn't nothing to do. I mean, there was one medication that they had talked about putting me on that had several side effects. Then after a couple of weeks after that, Dr. Ron had given me a call and said they had a trial they wanted to put me on, and we were all very happy for that. And like Hank Henry, like he said in his, basically I want to do something possibly to help other people in the future, if possible, with this. So basically we started on the trial, and it wasn't long till I did start improving, and basically right now I'm clear. I do have a few the tumors or whatever they call come up every now and then, and St. Louis or my doctor here will inject it, and I'm guessing with a steroid or something. Dr. Ron knows that. So yeah, basically, when I started taking the medicine, there wasn't. I know the doctors were concerned about the taste, and which really didn't affect me that much. The nausea was not that bad, and now I take nothing for nausea. I use no creams, and I still do a UVB and ultraviolet twice a week down here, and that seems to really help with the itching, and so. But yeah, here we are, and I'm feeling pretty good, and really happy for my good friend Dr. Ron and what him and the Mayo Clinic's done for me. It's been a blessing to me and my family. I got 3 young grandkids that I'm able to spend time with, and I know that was a big concern with me right off the bat because it does affect you. That's the whole thing about cancer. It does. Once you get the diagnosis, it affects you mentally, and people don't understand that. That's never gone through it. But it's a pretty tough time to realize in your life what's going on, especially after just retiring.
When I had initially met Jim and we were trying to think about what next treatment strategies would be good options, we really were limited, like Jim was saying. And I think this is important doing these clinical trials and these research because it offers these potential novel therapies that could potentially, be the next standard of care. Still early, of course, for the current trial that Dr. Abeykoon is running. But I think unless we do these trials, we don't know, and certainly it's very important that Jim was willing to be a part of the trial, and certainly it's worked out really well for him. And we can kind of go into more details when Dr. Abeykoon shares his slides.
Yeah, so this is with the permission from the patient that I am showing this. Jim is the patient. So you can see Jim's PET scan on the left side before starting the trial. And you can see all the white spots is his cancer that he just mentioned. And after treatment, you can see it is a complete response. There are no white spots, as you can see here. And that is what he was mentioning throughout his journey.
Thank you for sharing that, Dr. Abeykoon. So, I think one thing that Jim mentioned, which is really neat about your trial, is that from a side effect standpoint, Jim tolerated really well. I think one thing that when we were talking about Jim's case was, be extra cautious about the nausea, be careful about, other unknown side effects. I think the only bump in the road we really had was at one point Jim had some swelling that occurred in his legs, and he had it at one point in the kind of the face too. So, but that resolved with just some low dose Lasix. But he has had to stay on, I think, low dose Lasix since then. But I think that was the only really bump in the road we had from the blood count perspective. Very well tolerated, no need to do any dose reductions there. Um, and I know, so since Jim's kind of talked a bit about his experience on the trial, maybe we could get Hank's experience as well. So Hank, wanted to kind of turn back to you to see how things went for you while you're on the trial.
Well, it was interesting, to say the least. I started with surgery at the Mayo Clinic. They found the tumor in where they believe it started in my small bowel that metastasized to my abdominal area and looked like a spider-like webbing in my abdominal area. So the surgery went very well. They took out my omentum. And then there was a series of, I did some chemo. I did the AIM treatment initially. That was interesting. The ifosfamide, doxorubicin, and the Mesna. And then I did 5 rounds of that. I seemed to do that pretty well. It was a difficult time, especially trying to take this Mesna. I lost a little weight, lost some sleep. I had some difficult times, a few times where I got sick. And then from there, I went to a drug called etoposide, and then I migrated to Cotelic, and then another thing I think Dr. Abeykoon had put together, Selinexor and choline sialate. Please forgive my pronunciation. I hope I got that right. And then I went to Gemzar, Terilio, or Pexidartinib, and I'm currently on Sirolimus. I've kind of went the full gamut. I mean, I've had some difficult experiences. I mean, my neuropathies in both legs pretty bad. Don't have much feeling down there. I went through several days of vomiting episodes. I've been through that. Uh, One drug was really interesting. Dr. Zenmore was my doctor at Mayo at that time, and this Pexidartinib or Terilio, he said that my hair would probably turn white. Within 3 weeks, actually about this time of the year, it was about a year ago, within 3 weeks, everything turned white. My eyebrows, my eyelashes, my hair. It was I kind of laughed about it, but I like I say, there was a time where I started at 195 when this journey started. I've been down as low as 140. But I still remain positive and upbeat. I mean, the support of the doctors, I can't thank them enough from my heart, because Dr. Abeykoon's been there. And he would call me just to see how I was doing. And I can't tell you how good that feels to know that somebody really cares about me as a person. It makes a huge impact. And, I always continue and encourage people that you never give up hope. And, I find hope at the Mayo Clinic, and they're my hope. And I know they're looking for me and they're hoping they can cure me, but it's okay, because this journey, again, I wouldn't change this journey for anything. And I always continue to tell people, whenever there's a trial or an opportunity, you could be that person that changes everything. That's why you've got to step up and do these things, regardless of the possible side effects, because you yourself could be that cure. And that's hope. And I'm very grateful for that.
I'm trying not to cry myself. Hank, thank you so much. And Jim, thank you so much for sharing your stories. And I know it's been a long and difficult journey, and sometimes even just sort of I'll call it this little milestone victory of getting an accurate diagnosis makes a difference and can point you in the right direction. And I'm really grateful and relieved to know you both are feeling so hopeful and are having such a positive experience. And I'm very eager to share this trial with other people out there in the histiocytosis community. I think hearing your stories of hope and how you're feeling and just the level of support and care that you're receiving will be so meaningful for others as well. And so, thinking about that, I'm interested to know more about how others might be able to participate in this opportunity, maybe kind of walking through some of the eligibility criteria. If patients aren't currently being seen at Mayo, are they still able to participate? Maybe you can share a little bit more about that. And Jim and Hank, thank you so much for sharing your personal accounts with the Histio community, and really appreciate everything that you're doing to uplift and support each other and everyone out there.
Yeah, thank you, Henry and Jim. This means a lot to us. I mean, patients like you makes us to wake up in the morning and come to work. So regarding the trial, so then there will be one new trial that will be activated at Mayo Clinic and the University of Alabama starting January 2025. The first patient accrual will be around 30th of January 2025. But this current trial that Henry and Jim were treated is called LS 1981. So that is the trial that is CRM1 inhibitor plus the choline salicylate trial. So the eligibility criteria would be any patients with histiocytic malignancy. It can be malignant histiocytosis or ECD, RDD, Erdheim-Chester disease, Langerhans cell histiocytosis, Rosai-Dorfman disease. And patients who experience at least one line of treatment. All adult patients experience one line of treatment and relapse back, they can be successfully enrolled in the clinical trial. And not only histiocytosis, it is open for lymphoma patients with lymphoma as well. Any patients with lymphoma who has been treated with 2 treatments, any treatments, and relapsed. For lymphoma, for histiocytosis, only 1 treatment and relapse can be enrolled. This is a non-chemo trial, all oral. It is a pill and a syrup. Syrup will be taken 3 times a day, and the pill is twice a week. And everything is free, the treatment is free, but the thing is, like, it is only open, this trial is only open in Mayo Clinic, Rochester, Minnesota. So the patient needs to come and see us, or you can message us, you can message me, myself, email myself, or Dr. Rongo, or Thomas Witzig, or Jonas Paludo. And Dr. Ruan is here right now, but he will be completing his fellowship and been going to a different practice at in Minneapolis, but he will be remaining his ties with Mayo Clinic. So feel free to contact Dr. Ruan as well. And so that is that trial. The second trial is actually will be opening. I want to put a plug there. The same, any patient with histiocytic cancer, Erdheim Chester, Rosai Dorfman, Langerhans histiocytosis, or malignant histiocytosis, that trial actually, similarly, a patient who has been treated with first line treatment, or can be new patients where the patient cannot afford the first line treatment because of the cost or because of adverse effects. So in that setting, the patient can be eligible for this trial upfront. It is a CSF1R inhibitor, which is an oral pill that will be taken 1 week on, 1 week off, 1 week on, 1 week off. So 2 weeks in a 4-week period. It's an oral pill, not a chemotherapy regimen, that will be open for accrual in January 2025 as well.
Thank you. That's really exciting to know that there are several opportunities. And I know that people who are not being treated at Mayo Clinic or might be thinking about coming to Mayo Clinic might be wondering, how can I get there? Are there any parts of the trial that help patients who are needing to travel to? Also, the Histiocytosis Association can link in some different organizations that have transportation grants and things like that for patients. But I know sometimes clinical trials do offer some support, or Mayo Clinic might. So are there any opportunities there?
Unfortunately not right now, because this is a phase 1 investigator-initiated trial. So the budget is for the drugs, the testing, and to take care of the patients. But if we prove efficacy, we need about another 5 to 10 patients to close the phase 1 portion. And then once we prove the efficacy, when we go to phase 2, then we will be able to support the patients with logistics and the lodging and the transportation as well.
So this is a perfect time for people who are able to come to participate to also be able to help others in the future who might need that help with transportation and logistics. But if you are someone that needs help with transportation and logistics but are eager to get involved in the trial now, certainly reach out to the Histiocytosis Association, and we have a variety of different resources that we can share with you to potentially help offset travel costs and things of that nature. So this is a community partnership. We want people to be able to get the treatment that they need. Well, thank you so much for taking the time to share this information about this trial and the opportunity for the histiocytosis community and the lymphoma community. Thank you, Hank and Jim, for sharing your journey so far.
Well, I just like to say to all those people out there, don't give up hope. It's something very special. It starts in your own heart, but there's people that do care. People do encourage, and there's people there that are willing to help. But you have to step up and take those opportunities regardless of the consequences. Because again, you may be that hopeful person that they're looking for, and I highly encourage people to participate whenever they can. Thank you.
Yeah, I agree with Hank, and I just people. We've been granted gifts in our life, and Mayo Clinic's been one to us. And I'm astonished at how, and I don't criticize people, but You know, I don't think I've ever had a doctor around here that's called me personally, you know, but Dr. Ron calls me all the time and checks on me, and just it's just a blessing, and I know how busy these gentlemen are, and so it's just a whole different world at the Mayo Clinic, and what a blessing they've been to us and our families. So
Thank you, Hank and Jim, for your kind words and the trust that you've placed at Mayo here and in myself and Dr. Abeykoon. And um, I think just to echo what Hank and Jim have shared, for those who have this rare condition, please reach out for help and please be connected. And there are outstanding, groups such as the Histiocytosis Association and other, patient advocate groups. And it's important to get plugged in because this is, it's rare and we're all learning together on how to better improve the standard of care and provide better care.